Bismillahirrahmanirrahim. Assalamu alaikum. Hello and welcome back to my channel Diversity of Science. As I promised you guys earlier that in my next video I'm going to be discussing about the cancer treatment options that we have. So the best cancer treatment for you basically depends upon two factors. Number one, the kind of cancer that you have, and number two, how far the cancer has spread inside your body, which is also called as staging. Now, there are some local treatments like surgery and radiation therapy, which are used to treat the tumor or the area of the body superficially. Other treatments, such as chemotherapy, immunotherapy, and targeted therapy, are called systemic therapies because they affect the entire body. Chemotherapy. Chemotherapy is considered to be the most popular technique used for the treatment of cancer. Chemo means drug or the medicines used for the cancer treatment. Basically, it is a systemic treatment as the drug travels throughout the body and targets the cancer cells that have spread far from their original source. Now, many of you might be thinking, why does chemo causes a lot of side effects? Answer to this is the cancer cells grow very rapidly and the chemotherapeutic drugs targets the fast growing cells. So the healthy cells which are also fast growing in nature are also damaged. Now, the chemotherapy can be administered to the patient in two ways. Number one, through oral administration, which is by mouth, and number two, through IV administration, in which the drug directly enters inside the bloodstream through a needle. Radiation therapy. As the name suggests, this technique uses high energy waves such as gamma rays, X rays, used to destroy the cancer cells. Basically, it works by destroying the DNA inside the cancer cells to stop their growth. Cancer immunotherapy. This technique is considered to be the safest amongst all. Why? Because they use certain parts of immune system to fight the cancer by two mechanisms. Number one, by boosting the natural defense system of the body. Number two, by artificially producing substances that help restore the immune system. Targeted therapy. This technique uses medicines designed to target the cancer cells without affecting the normal cells. These drugs block the signals that makes the cancer cells grow. Hormone therapy. What are hormones? Hormones are proteins or substances made by the body to control the function of different cells, for example, insulin, progesterone, estrogen, etc. The medicines used in the hormone therapy travel throughout the body to target and find the hormones and seize their function. Because there are certain types of cancer that feed on these free flowing hormones and increase their size rapidly. The hormone therapy works by blocking the receptors, preventing the tumor growth. Surgery. The surgical method involves the removal of cancer from your body by carefully cutting out the tissues of cancer cells. Finally, the last technique that we have here is the bone marrow transplant. Now, what is bone marrow? Bone marrow is a spongy liquid tissue present in the center of bones whose main job is to make blood cells. Bones of the hip joint have the most quantity of the bone marrow inside them, and the process occurs when a large needle is inserted and the bone marrow is carefully sucked and replaced by the bone marrow of a healthy donor, similar to blood transfusion. This enables the body to help reform a healthy immune system for itself. So that was all for today. Thank you so much for watching. Before leaving, don't forget to hit the subscribe button. Take care.